Good morning, brethren. Today is Sunday of April 4th, 2021. It's a wonderful morning. It's around 2 a.m. in the morning. I take this wonderful chance to speak about something of experience and challenge that I hope that it could touch somebody else somewhere. Especially this time that we have been through, we have been challenged by many things. To commence, I'll start with a word of prayer, but my topic will be about how I managed COVID experience, the newborn preparation, and a new car, work schedule, school, and being a parent full time. So those are like five things happening simultaneously, which need thorough experience, thorough time, capital, and many things. So to commence ourselves with a word of prayer, in the name of the Father, Son, and the Holy Spirit. Amen. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done here on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. But lead us not into temptation. Deliver us. Thank you. Amen. So my experience is to talk about what was really my experience last year about COVID. COVID, when it started, it was like a very challenging time in our time, and especially a person like me who is an healthcare worker. I experienced challenges seeing patient dying. And what struck me most is like when family members would come to feast their family members, there was window, feast, which was very challenging. But I'm going to really speak, especially how I overcame the COVID experience and how I managed it, plus family and all that. So last year, around May 14th, before that May 14th, I came in contact with many patients who were infected. And you can imagine at that time we didn't have enough staff. And one of my experiences, I was working as a nurse, as a CNA, and all that to fill the void that was not there to save life. Unfortunately, I felt some symptoms. Personally, I diagnosed myself and said, well, I feel all I've experienced symptoms like those ones that my patients were having. So what I did around was May 10th, May 11th, I felt so cold and I started a very small cough, a dry cough. So I came home, I tried to lay down on the 12th, but I didn't feel better. So I decided on the 13th to call the doctor so that I can make an appointment. Maybe he can order the test for COVID. And the doctor was hesitating, like, "Oh, do you have a temp?" Based on the experience and the symptoms, not everybody had the same experience. Mine was mild, but the main goal here was I was able to detect it earlier, and hence it helped me safeguard or protect others, like my family. And I was expecting a baby to be born. That was my greatest challenge. So what I did, I came home, I slept, the day I was off was on Tuesday, uh, May the 12th of last year. So I decided, let me call the doctor on Wednesday. I did that, and what I experienced, the doctor sent an order to go to get checked out on the 14th. Because the test has a duration that takes longer than expected if they don't have the correct information for you. So because me had already started, when I started feeling any small symptom, I isolated myself. I would clean the car, I would clean the house knobs and all those things. I would take my own shower, had my own bedroom, all that. That itself saved family because I was with my fiance in the house and we had the baby being expected within a few days, like 25 days, the due date. So we overcame that, and I was the only one who survived, who had an experience. 5 to 7 days, I was cleared. Like everything was there. I was exercising, I was eating out, and I moved. I motivated myself. I did everything. And so that was it. And now the question was I wanted to have a test done to rule out whether I still have the infection. But I called the doctor. The doctor did not order the test. He said no. But the worst thing, she would send a bill for me without even having me tested to rule out that. Because my anticipation was I wanted the test done so that when we prepare to go for delivery, the doctors will have information so it doesn't cause problems. At that time people were more afraid of that. Fortunately, I was able to go to the surgical area and the baby was delivered, although it caused some commotion. Since I'm an healthcare worker and I know my symptoms, and I told them if you are afraid, you can test me to confirm my case because it has been almost 19 days at that time. So I managed that. Nobody got it except myself, and it went out. And now I'm going to talk about the preparation for the baby now, because somebody who has to go for the test at that time had to be tested for COVID. So my fiance got tested, it came negative, and we had to prepare to go on the date before. So we reached there. We were there by 4 a.m. of June, I think June the 1st. So June the 2nd. So the baby was delivered well, no issues, everything. I was able to be at the surgical area. I was able to take care of the baby. Sometimes I was afraid, but I was even wearing mask and everything. But it went well, and we survived that. The only shortcoming for me it was because I had not been cleared completely to make sure that there is no residues of the infection. So I had to wear my mask, gloves and everything, clean myself now and often until I was safe. So after we came out of the hospital, uh, less than 5 days, I got tested at another site which was free, and the test came negative. It was that time myself feeling confident to take off my my mask, but still I maintain it for the baby because my worry was about protecting the newborn, and you don't want to expose the newborn to the coronavirus. Also, at that time, there are many things I was thinking about because you have a new baby, you don't want to share the same car that I use for work. And that was my another challenge. So I had to get another car at that time to really use for the baby specifically and the mom and going to the doctor's feast and all that. So that prevented many things and it contained the disease from spreading itself and you don't want it to other people. From there, that was one step. So in less than 2 months, there was my fiance was to start schools, and it was challenging economically. You think about programs like nursing school; they have a very specific program, and finances have to be remitted within before you start the program. So we finished that, and we managed that. Now the next step was me becoming a full-time parent, a father, and taking care of my daughter and my fiance will go to school. And there, one of the greatest challenges I had to start to minimize my and to manage my time at work, change my schedule to meet the need and the requirement, which is also a very challenging issue economically and all that. But we have survived through that, and it takes a cost. A cost because when you plan to achieve something, you want to plan very carefully and very precise and aim at the target. So that was my aim. So because it's time focused, decisions or challenges. So we had to manage that, and we have survived through. And the programs we are about to finish that. What is my experience of all these things? One is how to contain the virus, Because for me, I had experience because as a worker, I had a good experience how we contain the spread. If we have a patient, we identify the infection, we isolate the patient, we monitor the symptoms for 14 days, and the patient is cleared. So I had knowledge about what to do, which prevented even if I was to communicate with anybody else, I had specific knowledge because I didn't take any medication to hate myself. What I did is good exercise and good health habits. And school, you can think about somebody going to school now 5 days a week. I'm now full time. Think of my job and think of being with a baby, a newborn, was new to me. So it was something experience of a lifetime, and I hope it is a challenge that takes character, courage, and we hope. You know, at this time, some people won't want to get babies at this time, but I hope that people should not be afraid. They should take chances. I'm a big risk taker, and I believe that anything that is in front of us is possible because I'm a believer in faith, not only in faith, I'm a believer in a better world. So I hope that this video can help each and anybody out there because we should not be afraid. COVID brought new expectation, new challenges to people, and people did not expect this. Imagine we are wearing masks, you're not touching the baby, you're afraid you will spread the infection if you get exposed. For me, I had to manage also work and preventing bringing the infection home because where I work, that's where I got the infection. So you think about things like that, your mind has to be very active and reasonable. You think, I don't want to bring it home. So whatever you do, you want to make sure. Like mostly, I spend most of my time wearing a mask in my house, which was challenging and nobody would think I would do that, but that is reality. I have experience of people who contacted infection from work and they took it to their family. I feel sorry for them, but it is very important for us to detect early symptoms and really prevent them from spreading to others. It was a great experience for me because it gave me that first-hand experience because I was used to do it at work and bringing that home and understanding it even when the doctors had called, from Christiana saying you need to Israel. I told them I already done that. I'm ahead of the schedule. That satisfied them. Even when I went to Christiana when they were afraid, I told them I'm an healthcare worker. I understand it is. I had the symptoms for only probably 3 days and they went off. But I've already isolated enough time that I know that I'm not infectious. But if you feel like you want to test me, feel free to do that. That was my answer. And they didn't have problem. We survived. We succeeded. So it's another time to hope for better days. Despite the pandemic, despite the challenges that we have, we should have a better perspective of how to do things because all these things, there's a timeline for them. We will overcome them. The pandemic will come to its end at the proper time, especially now that we have vaccine. Especially like me, I got my vaccine, my 2 doses by January the 19th. So I felt confident and I encourage anybody of you out there to go and get your vaccine. Do not be afraid. Vaccine help you to boost your immune system and also exercise, move. Because most people who died, especially patients, are the patients who had underlying conditions and they were not able to move. The majority that have survived up to now, from my experience, are those patients who are moving, they were eating, and they are happy now. You can see them, so you can sense what's really the effect and the impact of the people. I hope this message finds you out there and it can help you, it can encourage you, and together with our hope and our desires and our prayer also accompanied me because in all these times I was praying. I remember even